Hello everyone, welcome back to my channel. Today I'm going to talk about the health insurance. There are two health insurance in the Netherlands. One is public health insurance and the other is private. The public one is for a student who does have a job and they are working besides studying, or they're here in the Netherlands for working instead of the study. And for those whom they don't have any job, they don't need to have a public health insurance. And you should know that the public health insurance usually are more expensive than the private one. And today I'm going to talk about how you can apply for subsidy, which can reduce the public health insurance's monthly payment. And yeah, let's see. First, let's talk about the public health insurance. There are a lot of companies that offer a public health insurance. So here you can compare it by going to the Independer website and clicking here in the compare health insurance. You can choose what you want to have. I will talk about this part, the deductible part, because it's really important. I think the most important part here is this one. And you choose risk, and you will see the insurance companies that offer. Also, it's really important to put your date of birth. It's something randomly I put here, and your address for your house to see whether they have any contract with the hospitals near your houses, or for general practitioner which are near your house. Because if you are getting sick and you want to go somewhere far away and they don't have any the near GP doesn't don't have any contract uh, with your insurance company, then that's going to be a problem for you. So first thing to check is the GP. See whether they offer GP in your city, to see whether they offer any they have any contract with the company you found. Here, for example, you see this one. You will go in their website. I will give you a example later on, but you will go to the website and see whether they have any contract with the GP near yourself, near your home address. And yeah, you can see all the companies here, they listed it, and you can find out how's it going and see the companies which offer the public health insurance. For the private one, as I said, AON is one of the best one here. And usually, in my opinion, I think it's better if your GP supports AON. Not all hospitals or GP supports AON, but if they support it, it usually covers everything. So uh, the payment, it's 50-60 per month, and it's usually far better than public health insurance. So if you're not you don't need a public health insurance, don't switch between them. But again, you need to research yourself about these, everything yourself. It will cover everything almost. The AON one, the private one, and it's about 60 euro per month. Now let's talk about there are several other companies as well for the private health insurance, but you need to go to the websites and search about them. Now let's talk about the healthcare benefit. For this is only for the public health insurance. You should know that if you don't have your first job in the Netherlands, I mean, you come here as a student and you don't have any side jobs besides your studies, like any part-time jobs or anything, you can't switch to the public health insurance. You need to have your private one. But after you got your first job, you must switch to the public health insurance. This is a rule here. So if you are working, you need a public health insurance. And after having a public health insurance, even later on, if you lose your job, you can apply for a healthcare benefit. Even if you didn't lose your job or you didn't quit or anything, you can apply for a healthcare benefit. Uh, Here, they are going to give you some allowance to cover the money for your the monthly payment, the fee for your public health insurance. Because here you can see, for example, here it's the payment, it's 133 euro per month, and this is a lot more than 50 or 60 from the private one. So you need to pay attention. And they almost don't I mean, they cover a lot of things, but it's not as good as the AON one or other private insurance ones, even though they're more expensive. Now I'm giving you an example here. For example, later on, let me go on first. Uh, you, as I said, you need to you will come here. You will find out the name of the insurance company you want for the public one only, and uh, you will search for the website. I'm here going to the one I have my health insurance from. I will open the website, and here let me open it from the search. Here you want to find out which hospital does support this health insurance. You need to find out that, so you need to check the website, scroll it, and see where you can find it. There isn't any place for it, or I didn't find it here. I find it in the questions. Here, for example, am I allowed to choose which hospital I go for each treatment, something like that? Then you can here to healthcare funder. We will put everything here. Then here you find out which GP, for example, Huisarts are GP, general practitioner. Huisarts is the Dutch word for it. So you may need to have this one or say general practitioner. Usually you will find the results. Here in the Enschede, these GP has have a contract with my insurance company. So I can go after getting an appointment with them and registering with them, I can go there. And now let's talk about the uh, the coverage part. Let's find out what they cover, the public insurance, and how much does it cost. Well, let's choose. First, if you want to find out what it does cover, you need to put your date of birth and your, I think, city, maybe postcode or something like that. Then here, there are several packages. You can see it. You need to go through it. I always choose the cheapest one, so which is this one. But you can see the other one. I will talk about why I did choose the cheapest one, and I will always choose. Maybe later on I won't, but for now at least. And because this part, the deductible part. What does deductible part mean here? Well, it starts from 385 euros to 885 euros per year. That means you need to pay for the GP, for your pills, medicines, or anything up to 385 from yourselves. That means it doesn't matter what you do uh, until you pay 385 euros per year. You need to pay it from yourself. And the insurance doesn't cover it until you are almost covered 385 years. So I don't think I would get any kind of sickness or anything. Hopefully that goes beyond 100 euro. So I always choose the highest expensive one. For example, here is 885 because it's cheaper. If you choose the least expensive, 285 euro per year, it's you need to pay 153 per month. But if you go for 885, you only pay 138. That means 15 euro cheaper. And you can choose for dental insurance and other things as well. Here you can see what they cover. And when you apply for a healthcare benefit, at least for my situation, which I don't, I mean, I quit my job after several months and I don't have any. So for my healthcare benefit, I don't have any income. So therefore, I will get something around, I mean, I will pay something 15 euro per month, 15 per month for the fees of my healthcare. And yeah, that's the differences here. And for private one, it does cover everything, every pill. There's no deductible part. So it covers your GP, your medicines, and everything almost. But for the public one, you need to pay at least 385 euro from yourself before getting covered by the insurance party companies. You need to pay attention. And that was all I wanted to say. And you must pay attention to that. Uh, Having a job means you need to have the public health insurance. This is a rule here. So yeah, that's all. Everyone have a nice day, week, or anything. Bye. See you guys.